Blood pressure management is our health topic for today. Hello, welcome to another episode of Medication Station with Mello, your hub for essential drug and health information. As a pharmacist, my aim is to empower you with knowledge for educational purposes only. Always consult a trusted licensed medical professional for that individualized advice. In today's episode, I will guide you through accurately checking your blood pressure, understanding the factors that affect blood pressure, and consequences if left untreated. So, what is blood pressure? Blood pressure is the amount of force your blood exerts or uses to go through the arteries when the heart pumps. A blood pressure reading consists of two numbers. A top number, which is the systolic blood pressure, is the pressure in the arteries when the heart beats. And a bottom number, which is the diastolic blood pressure, is the pressure in the arteries between beats. Upon measuring your blood pressure, your pressure can be low, normal, slightly elevated, or high. According to the American Heart Association, a normal blood pressure is one with a systolic blood pressure less than 120 and a diastolic blood pressure less than 80. If you go into hypertensive crisis, your systolic blood pressure will be greater than 180 and your diastolic blood pressure will be greater than 120, in which case you need to reach out to your doctor immediately. Now let's talk about some key factors to help you take your blood pressure accurately. First, rest for at least 5 minutes with your back supported. Make sure you have both feet on the floor. Remove any bulky clothing. Keep your arm supported and at heart level. Usually your arm is resting on a table. Use a blood pressure machine with a cuff. The wrist and finger blood pressure machines are not as accurate. Make sure you use the right size cuff. If you have a larger arm, you may need to get a larger cuff size. Empty your bladder at least 30 minutes before you check your blood pressure if it is full. Take at least 2 blood pressure readings a minute apart and keep a log of your readings to take to your doctor during your checkups. Almost half of the adult population in the US have high blood pressure, and many are not aware they do. So what are some of the severe symptoms of high blood pressure? Severe headaches, dizziness, fatigue and confusion, shortness of breath, palpitations, nosebleeds, blurred vision, blood in the urine, anxiety, and chest pains, just to mention a few. So what are some of the things you can do to maintain a healthy blood pressure? If you have high blood pressure, you must be under the supervision of a healthcare provider. Make sure you take your medications daily as prescribed. Try to eat a healthy, balanced diet with low salt. Try to maintain a healthy weight. Always stay hydrated. Maintain an active lifestyle by exercising regularly. Quit smoking and limit your alcohol intake. Limit caffeine, soda, and sugar. Try to manage your stress level. And last but not the least, always keep your follow-up appointments with your doctor. Not maintaining or treating your high blood pressure may have dire consequences. It may lead to stroke. It may damage your kidneys. It may lead to erectile dysfunction in men. It may cause fluid to build up in your lungs. It may damage your heart and coronary arteries, and it may even lead to memory loss. So it's very important you keep your blood pressure under control. In conclusion, it is very important you monitor and maintain your blood pressure accurately. This brings us to the end of our topic for today. If you did not know all this, now you know. Please subscribe, share, and comment below as to what topics you would want us to talk about in the future. Thank you for watching. So long, Mellow.